these records when the department takes the unique situation to actually require them to pay back the physicians. We think it makes common sense to ask them to not have the physicians resubmit their claims. We appreciate your time and respectfully ask for your vote.
Thank you.
Amanda Levy on behalf of the California Psychological Association. Our members, thousands of members who contract with managed care panels, also jump through these hoops. We are in full support of the bill.
Thank you.
Juan Thomas, representing the California Medical Association, in support of the bill.
Les Shepard, representing the Association of Northern California Oncologists and the Medical Oncology Association of Southern California, in support.
Don Chinsky on behalf of the California Academy of Family Physicians and the California Society of Dermatology and Dermatologic Surgery, in support.
Thank you. Anyone else in support? Is there any opposition to the measure?
Chairman and members, Dan Chick with HealthNet. We are actually no longer in opposition. With the recent amendments taken, I want to thank the author, the sponsor, and the staff for addressing our concern that absent this amendment, the bill could have been interpreted to interfere with the delegated model. And we're very thankful once again for taking that amendment. Thank you.
Thank you.
Thank you. Charles Bakke with the California Association of Health Plans. We believe this amendment removes our remaining concerns on the bill. We expect to be removing our opposition when we see the amendments in print.
Thank you.
Thanks again to your staff,
Thank
and
you.
the author and sponsor.
Julie Broyles here on behalf of the California Association of Health Underwriters. Also happy to be able to say that we're going to review the amendments with the eye to removing opposition and appreciate working with the author and the sponsor on the bill.
Thank you. Is there any questions from any of the members? Comment from Senator Strickland?
I'd like to thank the Assemblyman working with the opposition. It's always a positive when you come with the final product that gets everybody moving in the same direction. So thank you.
Thank you, Senator. Okay, any other questions or comments? We have a motion to move the bill by Senator Ahlquist, Assembly member. I'll be supporting the bill. Thank you for bringing it forward. Please feel free to make a close.
Thank you very much, Mr. Chair. I'll just respectfully request your aye vote on a modest bill, but one that will help make sure that physicians get paid the amount that they're entitled to.
Thank you very much. This is a due pass as amended to appropriations. Secretary, call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Strickland, aye. Alquist. Alquist, aye. Anderson. Blakesley. DeLeon. DeSaulnier. Rubio. Wolk.
We have 3-0. We'll place that bill on call. Thank you. We have item number 15, AB 1296, Bonilla Healthcare Eligibility, Enrollment, and Retention Act. Good afternoon, Assembly member. Welcome.
Good afternoon. Thank you very much, Mr. Chair and members of the committee. First, I'd like to thank the chair and the committee staff for their help in refining this measure, and I'm happy to take up as author amendments those that are included in the mock-up. AB 1296 streamlines and simplifies eligibility, enrollment, and retention for public health coverage programs. The Federal Affordable Care Act provides and states with 100% federal funds from the exchange grant and 90% of federal funds from Medi-Cal expansion to build a single statewide application to be used by all entities processing applications for enrolling consumers in health coverage. The system must be available to apply by phone, in person, by mail, or online for enrolling into Medi-Cal, Healthy Families, or the exchange. AB 1296 enacts the Healthcare Eligibility, Enrollment, and Retention Act to implement the much-needed no wrong door, user-friendly, efficient application system that works for real people. The federal government needs to certify the exchange by January 2013 and test the eligibility and enrollment system by July 2013. The exchange grant application calls for vendors bidding by early 2012. Given this very ambitious timeline, legislation is needed this year to allow California sufficient time to build an effective system. This measure has widespread support and no opposition. I have with me Elizabeth Landsberg from the Western Center on Law and Poverty.
We have a motion by Senator Ahlquist Please state your name and your position. Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty. We're pleased to sponsor this bill to streamline the way Californians get public health coverage. Today, the onus is largely on the consumer to figure out what program she may be eligible for. If her circumstances change, she has to reapply to a new program. AB 1296 would change that, creating this new wrong door, building on the exchange legislation enacted by this legislature last year, and making sure that as people's circumstances change, we seamlessly move them from one program to the other. The Assemblywoman has ably described the bill. If there are any questions, I'd be happy to answer them. Thank you so much.
Thank you.
Good afternoon, Mr. Chair and members of the committee. Kathleen Hamilton with the Children's Partnership. We're also here in support of AB 1296. This bill represents a thoughtful and very needed and necessary blueprint for moving California forward to the next generation of healthcare enrollment. I want to just share a couple of brief thoughts. Certainly the creation of California's Health Benefit Exchange adds a dimension to the availability of health care coverage for all Californians. We can no longer sort of glue stick healthy families and Medicaid programs together. The Affordable Care Act requires us to add enrollment through the exchange as an additional state option for our Californians. While this presents certain challenges, they're absolutely achievable if we begin developing and planning for those enrollment changes now. Most importantly, the advent of this new rubric creates an opportunity not just to enroll more Californians in health coverage, but to really for California to lead the nation and demonstrate a thorough, competent, and timely approach to establishing a system that works. Let me just touch, if I might, on the calendar and going forward. The Health Benefit Exchange, as you probably know, just last week submitted a $40.1 million planning grant to the federal government. By far the largest portion of that grant, almost $28 million, is dedicated to assessing and developing the needed IT system. Clearly, the exchange has to know what it is it's developing in order to effectively utilize those dollars. The planning grant will then be followed by submission of an establishment grant application as soon as March 2012. Those grant funds will then be used to actually build the system. As a practical matter, that means that the exchange has to have the enrollment system details in place prior to March 2012. Additionally, California's exchange is required to be certified by the federal government in January 2013. Again, that means that systems must be in place during 2012. California's operational assessment by the feds will then take place in October 2013. Thus, the urgency of moving AB 1296 today. We thank you for your attention and hope for your aye vote.
Thank you.
Beth Capello on behalf of Health Access California, California Pan-Ethnic Health Network, AFSCME, and UNEC also in support.
Stephanie Hodson with United Ways of California, also in support.
Mr. Chair, Juan Thomas, representing the California Medical Association, in support of the bill.
Judy Wolin with NAMI California, in strong support.
Kathy Mossberg, California Family Health Council, in support.
Matthew Monson with Public Health Institute, in strong support.
Rebecca Gonzalez, National Association of Social Workers, California chapter, in support.
Kelly Brooks on behalf of the California State Association of Counties, also in support.
Judith Weigel with the County Health Executives Association, in support.
Kathy Sunderling with the County Welfare Directors Association, in support.
Kirsten Barlow with the California Mental Health Directors Association, in support.
Thank you. Any opposition to the measure? Any questions or comments from any of the members? We had a motion to move the bill by Senator Alquist. The chair will be recommending an aye vote. Thank you for bringing this issue before us. Feel free to close.
I respectfully ask for your aye vote.
Thank you. This is a due pass as amended to appropriations. Secretary, call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Strickland, no. Alquist. Alquist, aye. Anderson. Blakesley. DeLeon. DeSaulnier. Rubio. Wolk.
Aye.
Wolk, aye.
Got 3-1.
That has 3-1. We'll place that bill on call. Thank you.
Thank you.
And we're, I believe, on the final bill of the day, item number 16, AB 1297, Chesborough Medi-Cal Mental Health.
That would be me.
Good afternoon. Good afternoon, me.
Thank you, Mr. Chair. Good to see you over here in the Senate Senator Hernandez. AB 1297 will ensure California accesses all available federal funding for Medi-Cal specialty mental health programs. This program plays an important role in ensuring that children and adults enrolled in Medi-Cal get the services they need to help them with serious mental illness or emotional disorders. By changing a small number of unnecessary administrative requirements, this bill will enable counties to annually receive as much as $100 million they were currently leaving on the table in Washington, D.C. AB 1297 simply requires that this program be guided by federal Medicaid requirements so that the counties can submit their claims within federal timeframes and be fully reimbursed at the levels our federal government makes available. We have agreed to make some minor amendments to the bill on issues that were raised in your analysis. They're in mock-up form and are in front of you. Here with me today is Kristen Barlow, representing the California Mental Health Directors Association, the sponsor of the bill, and she will explain some of the specific policies this bill addresses and answer any of your more technical questions on the subject.
Mr. Chair, I'd like to move the bill as amended after testimony, but I believe this has support on both sides.
Okay, we have a motion by Senator Strickland. There is support on both sides. There won't be any opposition. Appreciate it. We can just keep it brief and state your name and your position. Thank you.
Kirsten Barlow with the California Mental Health Directors Association. We represent the county mental health departments throughout the state and are the sponsors of this bill. As was mentioned, really the purpose of the bill is to reduce some of the state-level administrative requirements that are not in compliance with what the federal government requires in the Medi-Cal Specialty Mental Health Program. And instead, let's just follow the federal requirements rather than leave dollars on the table in Washington, D.C. that should otherwise be coming into our county mental health system in California. A couple of the specific things that the bill does is address the time frames during which counties can submit claims to the state. County mental health departments pay the full upfront cost of specialty mental health services in our state. We then wait to be reimbursed. We submit our claims to the state, who then seeks federal reimbursement from Washington, D.C. We would, under this bill, have 12 months to submit those claims, which is what the federal government requires. Additionally, the reimbursement amounts that we actually are able to get from the federal government are broader than the schedule that the state has been publishing for the past number of years and have frozen those rates actually to ensure that state general fund exposure was minimized. These two programs, as of last week, will be realigned to counties. We will have the full financial risk for the program, so it doesn't make sense from our perspective to continue to have any state-level requirements that do not follow federal Medicaid laws and, again, keep federal dollars in Washington rather than here in California. We urge your aye vote. Thank you.
Kelly Brooks on behalf of the California State Association of Counties. The conversations around AB 1297 are exactly the conversations we should be having generally in the Health and Human Services area as it pertains to realignment. We're very much in support of the bill. Thank you.
Donna Seitz, representing Los Angeles County Board of Supervisors, in support and urge your aye vote. Thank you.
Cindy Hillary, Regional Council of Rural Counties, in support for the reasons stated previously. Thank you.
Nicole Wertelman, City and County of San Francisco, in support.
Devin Anderson on behalf of San Mateo County, in support.
Rebecca Gonzalez, National Association of Social Workers, California Chapter, in support.
Thank you. Any opposition? Are there any questions or comments from any of the members? We have support on both sides. The amendments were passed out. This was do pass as amended. The chair will be recommending an aye vote. Would you like to close?
I respectfully ask for your aye vote.
Thank you. Secretary, call the roll.
Senator Hernandez.
Aye.
Hernandez, aye. Strickland. Strickland, aye. Alquist. Alquist, aye. Anderson.
This is Ray. You can vote aye.
Anderson, aye. Blakesley. Blakesley, aye. DeLeon. DeSaulnier. DeSaulnier, aye. Rubio. Wolk. Wolk, aye.
That has 7. We'll still place the bill on call. We have some absent members. Thank you,
Mr.
Assembly member. Yeah, we're going to move the consent calendar. That's item number 1. We have a motion by Senator Strickland, Senate Committee on Health, consent calendar. Secretary, call the roll.
Did you move the bill AB 62?
AB 62.
Senator Hernandez?
Aye.
Hernandez, aye. Strickland? Aye. Strickland, aye. Alquist? Alquist, aye. Anderson? Aye. Anderson, aye. Blakesley? Aye. Blakesley, aye. De Leon? DeSaulnier? DeSaulnier, aye. Rubio? Wolk? Aye. Wolk, aye.
That was 7-0. We'll place that bill in call and wait for the absent members to return. Okay, we're going to start at the top. Item number 2. I'm sorry, we'll start with item number 1, the consent calendar, AB 62, Manning. Secretary, call the roll.
Senator De Leon? Aye. De Leon, aye. Rubio? Aye. Rubio, aye.
What about, did DeSaulnier? Oh, yeah. That vote count is 9-0. That bill is out. Item number 2, AB 210, Solorio. This is due pass as amended to appropriations. The current vote count is 3-1. Call the absent members.
Senator Anderson?
Item number 2.
No. Anderson, no. Blakesley? No. Blakesley, no. De Leon? Aye. De Leon, aye. DeSaulnier? Aye. DeSaulnier, aye. Wolk?
That vote count is 5-3. The bill is out. Okay, item number 3, AB 215, Bell, do pass to the floor. The current vote count is 4-0. Call the absent members.
Senator Anderson? Anderson, aye. Blakesley? Aye. Blakesley, aye. De Leon? DeLeon, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That's 9-0. That bill is out. We have item number 4, AB 395. Assemblymember Pan. Due pass appropriations. Current vote count is 4-0. Call the absent members.
Senator Anderson. Anderson, I. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That's 9-0. That bill is out. Item number 5, AB 540, Bell. For current vote count is 4-0. Due pass to appropriations. Call the absent members.
Senator Anderson. Anderson, I. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That has 9-0. Bill is out. Item number 7, AB 581, John A. Perez. I believe we need a motion in this one or not? Oh, we're in item. Okay, I'm sorry. Item number 6, AB 574, Lowenthal. This is due pass to appropriations. Current vote count is 3-0. Call the absent members.
Senator Hernandez.
Aye.
Hernandez, I. Anderson. Anderson, I. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I. 9.
That has 9-0. That bill is out. We're on item number 7, AB 581, John A. Perez. We need a motion. We have a motion by Senator DeSaulnier. This is due pass to appropriations. Due pass as amended to appropriations. Call all the members.
Senator Hernandez.
Aye.
Hernandez, I. Strickland. Alquist. Anderson. Anderson, no. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Rubio. Rubio, I. Wolk. Wolk, I.
That has 6-1. That bill is out. Item number 9. Item number 8, AB 589, Perea. This is due pass as amended to appropriations. The current vote count is 4-0. Call the absent members.
Senator Anderson. Anderson, I. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That's 9-0. The bill is out. Item number 9, AB 641, Fuhr, long-term health care, due pass to appropriations. Current vote count is 4-2. Call the absent members.
Senator Anderson. Anderson, no. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That vote count is 6-3. The bill is out. We're at item number 10, AB 688, Pan. That's due pass as amended to appropriations. Current vote count is 5-0. Call the absent members.
Senator Anderson. Anderson, no. Blakesley. Blakesley, I. DeSaulnier. DeSaulnier, I. Wolk. Wolk, I.
That is 8-1. The bill is out. We're at item number 11, AB 727, Mitchell. Due pass to appropriations. Current vote count is 2-1. Call the absent members.
Senator Anderson. Anderson, no. Blakesley. Blakesley, no. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Rubio.
Item 11, the vendors. I voted yes.
Rubio, I. Wolk. Wolk, I.
That vote is 6-3. The bill is out. We have item number 14, AB 1059, Huffman. This is due pass as amended to appropriations. Current vote count is 3-0. Call the absent members.
Senator Anderson. Anderson, no. Blakesley. Blakesley, I. DeLeon. DeLeon, I. DeSaulnier. DeSaulnier, I. Rubio. Rubio, I. Wolk. Wolk, I.
That vote count is 8-1. The bill is out. We're at item number Item number 15, AB 1296, Bonilla. This is due pass as amended to appropriations. Current vote count is 3-1. Call the absent members.
Senator Anderson? Anderson, no. Blakesley? No. Blakesley, no. DeLeon? Aye. DeLeon, aye. DeSaulnier? Aye. DeSaulnier, aye. Rubio? Aye. Rubio, aye.
That vote count is 6-3. The bill is out. We're at item number 16, AB 1297, Chesbro. This is due pass as amended to appropriations. Current vote count is 7-0. Call the absent member.
Senator DeLeon? Aye. DeLeon, aye. Rubio? Aye. Rubio, aye.
That's 9-0. The bill is out. Item number 17, AB 1329, Davis. This is due pass as amended to appropriations. Current vote count is 3-0. Call the absent members.
Senator Anderson? Anderson, aye. Blakesley? Aye. Blakesley, aye. DeLeon? Aye. DeLeon, aye. DeSaulnier? Aye. DeSaulnier, aye. Rubio? Aye. Rubio, aye. Wolk? Aye. Wolk, aye. Okay, that's 9-0.
That vote is 9-0. The bill is out. I think we're prepared to adjourn the hearing. Are we prepared to adjourn the hearing? We're at item number 18. Absolutely no problem. We're going to add item number 18, AB 52. This is we have a due pass to appropriations. The current vote count is 2-2. Call the absent members.
Senator Anderson? No. Anderson, no. DeLeon? Aye. DeLeon, aye. DeSaulnier? Aye. DeSaulnier, aye. Rubio? Wolk? Aye. Wolk, aye. So we've got 5.
That vote is 5-3. The bill is out. Before we adjourn, I'd like to just take a little time of personal privilege just to make a couple of comments. This ends the Senate Health for this first year cycle, and being the chair of the committee, I was ecstatic to, first of all, to receive it. But let me thank all of the committee members for all the work they've done. They've done an excellent job. Thank you. But I think the absolute most important thing that I need to do is to thank my staff. Not only Tim Valderrama, he's been a superstar, but the entire Senate Health staff. They have just been incredible to work with, starting from, Peter and on down. You guys have really made a big difference in me running this committee. So I wanted to personally thank all of you for everything you've done. It's a great job. So with that, we will adjourn, and thank you.